Uveitis is a very broad term that encompasses a variety of conditions and diseases, but overall it indicates inflammation inside the eye. The tissue that is involved by this inflammation, or where this inflammation starts, is the uvea, hence the term uveitis. The uvea is the vascularized layer of the eye. That means the layer of the eye that contains blood vessels. There are three different parts to the uvea. The most easily identifiable one is the iris, which is the colored part of the eye. Then the middle part is the ciliary body, and the back part is the choroid. So the inflammatory process inside the eye can involve different compartments, such as the front part of the eye, the middle of the eye, or the back of the eye. When all of these layers are involved at the same time, we talk about panuveitis, which means inflammation of the eye as a whole. As I said, uveitis is a very broad term, so risk factor are different for different conditions within the spectrum of uveitis. However, it tends to involve people that are in their working age, so usually 20 to 50 years, and females a little bit more than males. However, it's a condition that's been reported in children as well as elderly people. The diagnosis is made by a uveitis specialist. That is an eye doctor that specializes in inflammation of the eye, and it's first and foremost carried out through an ocular exam. So your eye doctor will look inside your eye and determine if there's inflammation. Sometimes additional testing is needed, such as fluorescein angiography. That is a test that involves the injection of a dye in one of the veins and allows your eye doctor to identify if the blood vessels in the back of the eye are inflamed. Another very important tool that we use is optical coherence tomography. That is a scan of the back of the eye, of the retina specifically, that allows to identify inflammatory complications such as macular edema or swelling of the retina. The main causes of uveitis are either infectious or autoimmune, also known as immune-mediated. Infections can be bacterial, viral, fungal, parasitic, so there's a variety of infections that can involve the eye. However, those represent a minority of the causes of uveitis. Most often, this is an autoimmune process, meaning that the immune system is attacking parts of the eye when it shouldn't. This can be related to another autoimmune condition going on elsewhere in the body, so what we call a systemic condition, a systemic autoimmune disorder. Or in at least half of the cases, it can be a process that's confined to the eyes alone. So it is an autoimmune process that attacks the eyes but not the rest of the body. The systemic conditions that are most commonly associated with uveitis are rheumatologic conditions such as lupus, sarcoidosis, rheumatoid arthritis, and many others. Research in uveitis is focusing on delivering the best possible treatment to patients. That is either in the form of local treatment or systemic treatment. Uveitis can be treated either with drops or injections, often of steroids or other agents in the eye or around the eye, or with systemic medications as well, which include steroids or what we call immunomodulatory therapy. So the latest research is focusing on an effective way of delivering drugs to the eye in the form of injections, whether in the vitreous, so the intraocular space, or the suprachoroidal space, so in a space that's between the uvea and the sclera, which is the wall of the eye. Why are we looking at different ways to deliver these medications? So that we can minimize the side effects that some of these medications can have inside the eye. The same is true for systemic medications, such as biologic treatments that are focusing on modulating different parts of the immune system to assure good control of the inflammation inside the eyes, again, while minimizing side effects to the patients.